So I'm going to talk today about our study where we've looked at what the impact of cuts to local government investment in early childhood services might have been on childhood obesity in England. In particular, we're interested in cuts to spending on Sure Start children's centres. And this is a project that's part of the NIHR-funded School for Public Health Research, of which Liverpool is a member. So just some background on childhood obesity in England first. About 10% of children in England are living with obesity by the time they start school, and this figure doubles by the end of primary school. On average, for children at the start of school, so the reception year, this prevalence has remained fairly constant over the past 10 or 15 years, with rates having plateaued after rising quite sharply through the 1990s. But it's stuck now at a level that's high relative to many comparable countries across Europe. And although the average prevalence of obesity has remained fairly constant in recent years, this is masking differential trends and levels of obesity across society. So data from the National Child Measurement Programme shows us that children from the most deprived areas in England are far more likely to be living with obesity compared with children from the least deprived areas. And that deprivation gap has been widening in recent years. As you may have seen last week, the data from the most recent year of the National Child Measurement Programme have now been released, and they show an alarming increase in obesity during the COVID-19 pandemic, and a particularly worrying further widening of the deprivation gap. The UK government's childhood obesity plan states that they have a commitment to halving childhood obesity and significantly reducing the gap between children from the most and least deprived areas by 2030. But despite this stated concern for inequalities, the Tory and coalition governments of the past decade have also overseen huge cuts to local authority budgets across England as part of their far-reaching austerity programme. And these cuts have disproportionately hit more deprived parts of the country. So one consequence of these sort of severe reductions in central government funding to local authorities has been the need for councils to prioritise the services that they have a statutory obligation to provide. And this has come at the expense of spending on discretionary services, so services they've got more control over making cuts to. So one such discretionary service that's been dramatically cut in a lot of areas is Sure Start children's centres. And these centres provide a range of community-based services that support children and their parents from conception through to age 4. The programme was designed to promote health and development and to reduce inequalities. It began in 1999 under a Labor government, and initially it prioritised more deprived areas before later being rolled out more universally. And since 2010, local authorities' spending on children's centres has fallen by more than half. And as this plot shows, these cuts have been deepest in more deprived areas. So this is quintiles of deprivation. You can see the much steeper decline in funding for the more deprived areas. On the ground, what this has meant has been the closure of many children's centres and the scaling back of services offered in the centres that have remained open. When the Sure Start scheme was introduced, it had various aims, but one of its explicit aims was to help prevent childhood obesity. So how might children's centres help to prevent childhood obesity? Well, this figure shows various pathways through which the centres might impact obesity risk. Some of these are direct pathways, for example, through obesity prevention programs delivered in some centres and through general health promotion around nutrition and active play. On the right, there's other pathways that are indirect through services that address the wider social determinants of child health. So, for example, most centres provide or did provide links to employment and welfare support for parents. Many provided parenting programs promoting child development and support for parents' mental health. And then there were other services offered in a lot of centres, such as smoking cessation and breastfeeding support. And these are services that can impact on perinatal risk factors for obesity.
Sorry, Kate, we can't hear you there.
Sorry, yeah. How long ago did I mute all of a sudden?
Just as you were talking about perinatal.
Okay, right. Great, okay. So perinatal risk factors, there's another pathway there. So services like smoking cessation and breastfeeding support. So given the cuts to investment in children's centres and the fact that deprived areas have borne the brunt of those cuts, and given these various ways that children's centres might influence obesity risk, we wanted to know if the recent trends in spending on children's centres have had an impact on obesity prevalence at a local level. So we designed a longitudinal ecological study using publicly available data for local authorities in England for the period from 2010-11 to 2017-18. So this covers the main period of the spending cuts, and it's when we had the period we could get reliable data for. At the local authority level, there's variation in obesity prevalence, and there's variation in the extent to which spending on Sure Start was cut. So we took advantage of this variation to examine whether the prevalence of childhood obesity has increased more in those local authorities where Sure Start spending cuts were greater. We used data published by local authorities on their annual expenditure on children's centres. This is published in annual reports that the Department for Education release. And then we use data from the National Child Measurement Program for children in the reception year of school, so when they're aged 4 or 5. And this covers most children of that age in England. We used a fixed effects panel regression model, which allowed us to estimate the average change in obesity in a local authority when public spending levels change, independent of any background national trends in obesity. And it allows us to control for differences both between and within local authorities that might influence both spending levels and obesity prevalence over time. I was asked to focus on the results and their implications today, so I won't go into more detail on the methods now, but I am happy to talk about that some more if anyone's got any questions. But just to say that we also conducted a series of additional analyses to check the robustness of our results to possible sources of bias or misspecification of the model. I've listed those here and I'm happy to talk about any of those. Now, main finding was that child obesity prevalence tended to increase more in areas where Sure Start spending had been cut more. Every 10% cut in spending was associated with a relative increase in obesity prevalence of 0.34% in the following year. And that's against a baseline prevalence of about 9.5% in 2010. This plot shows those results in more concrete terms. So the red line shows the number of children with obesity that was actually observed, while the green dashed line shows the expected number of children with obesity if spending on Sure Start had been maintained at 2010 levels. So the gap between these two lines, this is what we interpret as the estimated effect of the spending cuts. Given the extent of the total cuts to Sure Start over the study period, this means we estimate that by 2007, there were an additional 4,500 children with obesity when they started school, over and above what would have been expected if spending had remained at 2010 levels. And when we also separately looked at overweight and obesity combined, the number was sort of about double that. We found that the magnitude of this relationship was similar regardless of how deprived an area was. But because we know that the spending cuts have been far greater in more deprived areas, in absolute terms, that means that the impact in terms of childhood obesity will have been felt much more severely in those areas. And these are also areas where there's a greater burden of childhood obesity to begin with. We also found that the relationship was more pronounced in areas where obesity prevalence had been falling prior to the spending cuts. So this suggests that areas where child obesity prevalence had been declining in the pre-austerity period, these areas were more sensitive to spending cuts than areas where prevalence had been stable or rising prior to 2010. And we can't read too much into that, but it does imply that those earlier reductions in childhood obesity that had been achieved in those areas may have been at least partially due to the services provided in children's centres. And this, so this may lend some further support for a causal interpretation of our main finding. So to sum up, these findings indicate that sustained disinvestment in Sure Start may have contributed to the problem of childhood obesity, and that continued disinvestment in services such as these for children and for their parents in the early years, especially in more deprived areas, risks further exacerbating inequalities. And at a time when, from that, the most recent obesity data, at a time when we really can least afford for that to happen. You'll probably be aware that a few weeks ago, the government announced a commitment of £82 million to fund what they call family hubs, which on the face of it sound very much like Sure Start children's centres. If this does turn out to be a return to investing in children's centres, then I'm sure lots of people will welcome that. But while it's a start, £82 million won't make very much of a dent at all in the cuts to investment in children's centres that have happened over the past decade. Those amount to around £1 billion. Importantly as well, the benefits of Sure Start children's centres have been shown to go well beyond obesity. So several other studies have shown children's centres provide kids with a range of benefits for their health and development. So the impact of recent cuts to spending on Sure Start is likely to cover a range of outcomes beyond the obesity impact that's suggested by our study. And we know that there's no single solution to the problem of childhood obesity. Lots of other research tells us that a multifaceted system-wide approach is needed. But what our study suggests is that reinvesting in Sure Start could be one effective part of a broader strategy to tackle childhood obesity, while also conferring a whole lot of other benefits for children and their parents. So I'll leave it at that. Thanks very much for listening. I'm happy to answer any questions or discuss any of this further. If you're interested in reading the full paper, it's published open access and the link's there. And I should just acknowledge my co-authors in the paper as well, colleagues at the University of Liverpool and at Durham University. And just to say as well that if you're interested, this work's part of a wider program of similar studies that our group's been doing to understand the health impacts of recent cuts to investment in a range of services delivered by local government. So I'd be happy to share details with anyone who's interested in those other studies as well.